Welcome to our webinar on AI and technologies for diabetes management with Prof. Yam from the National University Hospital, Singapore. Explore the impact of diabetes, discover tips for a healthier life, and learn about innovative management tools and AI for a lifetime of good health.
This idea. Earlier, I shared the idea of this thing called insulin resistance. So exercise, any form of exercise reduces insulin resistance. That means that it promotes your body cells to take up the sugars from your blood and therefore decrease the damage of that high sugars can cause to the blood vessels, right? Obesity is also another cause of diabetes. So because we have a lot of nice food in Southeast Asia, we tend to overeat and can cause obesity. And to talk a little bit more about why is it more it impacts Asians greater, right? So this paper talked about how diabetes impacts Asians more than, say, the West. And the reason is because Asians are genetically more prone to diabetes. That means we have this set of genes, right, in Asia, and especially in South Asia, right, that results in people becoming diabetic even if they are not obese. So you can become diabetic even if you're not obese. Whereas in the West, it's the other way around, where typically the people who have diabetes are the ones who are very obese, that they're not just overweight, they're obese. Obese means that their weight is much, much bigger than their height. So this is unique to Asians, and this is caused by something called insulin resistance, like I mentioned earlier. So why is that the case? Well, not just because our food is very rich and not just sweet and sugary kind of foods, but we also have very rich food, right? You can imagine the kind of foods that we take are high in carbohydrates, usually, and everything from white rice to sugary drinks. These are all high carbohydrate intake. And in Malaysia, the incidence of diabetes is going up by the rate of from 11.2% in 2011 all the way to 18.3% in 2019. So that's a big, huge jump, right? In Singapore, the incidence is about half of this, but still it's very high relative to the West by percentage of people having diabetes. So some of you might wonder, okay, so what's wrong with having high sugars, right? High sugars, I just feel sleepy or tired or have some symptoms of diabetes. What's the big deal? Well, the big problem with diabetes is that it injures almost every part of your body, right? And it doesn't do that with any symptoms. So you don't feel pain, you don't feel have any kind of symptoms that will alert you to the fact that your body is being damaged by high sugars. So if you look from the left here, right, it affects the eye because it affects the small blood vessels in the eyes, right, by causing damage to the blood vessel walls. And this results in these things called retinopathy, macular edema, cataract, and glaucoma. So it affects both the front of the eye, where you get cataracts, or your eye lens becomes opaque, that means it becomes hazy. And it also affects the back of your eye, which is the place where the light is being detected, right, when it passes through the lens, and causes blindness, right? So diabetes is one of the leading causes of blindness in the world. So it can damage not just the small vessels, but also the front of the eye. And using the same mechanism, it can also damage the kidney, right? And it can cause the small, the little filtration units called the nephrons in the kidneys to be damaged, as their small vessels are injured by high sugars, right? So this is called nephropathy. And when you get kidney damage, it progresses from stage to stage until a point where your kidney fails, and then most patients in Asia end up with dialysis, right? Whether it's using the machine to dialyze, the blood-based hemodialysis, or you're using peritoneal dialysis, which is a liquid-based kind of dialysis. The same injury to the small vessels also injure the small vessels to the nerve, right? So the nerve endings in your hands and your legs get damaged. So most patients feel increasing numbness, and because they can't feel their toes, they tend to injure themselves easily, causing foot wounds and ulcers. So we call diabetic neuropathic ulcers, right? So these ulcers can be painful. but later they can be completely painless and they don't heal very well. And they don't heal very well because the blood vessels that are supplying the toes or the extremities, that means the fingers and the toes, they become damaged as well by the diabetes, the high sugar. And this results in what you call peripheral vascular disease, right? And decreased flow of blood, and therefore the wounds don't heal, right? When we don't heal, they turn into ulcers. So, you can see how diabetes is so terrible because it can not just damage your key organs like your eye and your kidney, but in combination with damaging nerves and vessels, it can cause injuries to the leg and eventually amputation because the foot cannot heal properly, right? Of course, it also damages the big vessels, not just in the legs and the arms, but it damages the big organs like the heart and the brain, right? So in the heart, it can cause hypertension and heart attack or coronary artery disease. And of course, in the brain, it damages the big and small vessels. The big vessels will cause stroke, and the small vessels, you can end up with what we call cognitive impairment, right? So diabetes is a terrible, terrible disease. And the worst part about all of this is that it does so silently, meaning that there's no sudden sign that makes you realize that your organs are being damaged until it's too late. When it's too late, then you start to see all these signs where you go blind, you don't see properly, or you have kidney impairment and you feel all sorts of trouble with your what you call the electrolytes, the salts in your body. You start having ulcers in your leg, you get heart attacks, you get strokes. So these are things that are much later, after many years of high sugars, that can result in these kind of terrible complications. So to control your sugars, right? This is a table by the AACE, which is an American association that looks at diabetes control. And it prescribes these things of a combination of 2 or 3 things, right? So first thing is, of course, lifestyle therapy, meaning, like I mentioned earlier, diabetes is not just a genetic disease. It is also a lifestyle disease. So first thing to do is to, of course, look at the diet and look at exercise, right? And of course, lose weight, right? So these are applicable at any level. And if you have what you call the A1C, now let me explain what the A1C is, right? The hemoglobin A1C is a blood test that you can do, right, to determine how good or bad your sugars are over a period of 3 months. So this is not the same thing as your blood sugar. So a lot of people confuse this, right? They confuse that your blood sugar must be less than 7.5 or so and so forth. Okay, so don't get that wrong, right? Blood sugar is blood sugar, right? You need to keep your blood sugars between 4 to 8 millimoles per liter. In most of Asia, we use that unit. Hemoglobin A1C is a measurement of your red blood cells, right? Hemoglobin is your red blood cells, and A1C is a special protein on the top of the hemoglobin that is changed by the sugar levels in your blood. So when you have high sugar levels for a long time, your hemoglobin A1C will go up, and it's measured by percentage, right? So the percentage we want to achieve is 7% or less. Okay, so if you have a hemoglobin A1C of more than 7%, it is very, very likely that you're diabetic. And if you have more than 7.5, at the very start, everyone gets this medication called metformin. So all the diabetics who are on this call, and anyone who is diagnosed as being diabetic will almost always be started on metformin because it's the most effective medication to treat diabetes at any stage, right? Whether you are early stage, middle stage, or late stage. So everyone, gets on metformin. You can see here, monotherapy means a single drug. You can choose one of these drugs. Of course, the first drug you will choose is metformin. However, if your sugar control is not as good, that means your entry hemoglobin A1C is more than 7.5, then you have to take 2 drugs, right? So it's metformin plus any one of these, what you call second line or other first line agents. You can see other drugs here. So there's a whole long list of these names, but don't get worried about them, because these are things that your doctors will prescribe, right? Depending on the severity of your illness. And if you are even worse, that means despite being on 2 medications, you're still not controlled, then you should be on 3 medications, right? So these medications work together to prevent you from progressing in terms of your diabetes by controlling the sugar. And they're also to be used together with certain patients with, say, for example, heart problems or kidney problems, because some of these drugs are particularly good at preventing progression of kidney damage or heart problems, right? Like heart failure and so on and so forth. So these are very well established drugs. They've been used for, especially metformin has been used for decades, many, many years. And there are some of these other drugs here that have been around that came around in the last 10 years or so. These have been proven to be very effective in preventing not just diabetes, but the complications or the damage to those organs that I mentioned about earlier. And finally, you can also add insulin. So insulin is a drug that I mentioned earlier. It's a hormone that's produced by the kidney, but it can also be used as an injection to bring your sugars down. Because insulin therapy is not very pleasant because you have to give yourself injections on a daily basis. However, some patients are so poorly controlled or they don't have any more insulin, they need insulin to move the sugars into their cells. So this is the mainstay of treatment. Just to summarize again, the first thing is to do lifestyle therapy, which is diet control, exercise, and weight loss. And then, depending on the severity of the illness and the control, to start on 1, 2, or 3 combination of medications and or to add insulin if it's very, very poorly controlled, right? So the treatment of diabetes is very, very clear, right? Everybody knows that we need to treat diabetes in a certain way. And this is the way the doctors will be prescribing medications. And usually it's done on a 3-monthly basis, right? Every 3 months, we will assess and to see how well the sugars are being controlled before we say, okay, let's increase the medications, or you're doing very well, let's decrease the medications. So this is another chart from the American Diabetic Association that looks at, what I call the holistic person-centered approach to type 2 diabetes management. So it's a long word, but let me just explain this chart very quickly, right? Because we want, the goal is to prevent complications and to increase the quality of the life of the patient with diabetes. And we do it through 4 ways, right? 4 ways to manage diabetes. So the first thing to do, right, is to control the weight. So if you haven't controlled weight management, haven't achieved an ideal weight, it's going to be very, very hard to control the diabetes. So to control weight, we need to set what you call weight management goals. So a combination of lifestyle advice like medication, nutrition, dietitian advice, exercise, so what we call supervised exercise. That means we ensure that people stay on track on their exercise, combined with a weight management program. And if that fails, then patients should go on medications for weight loss. So I'll share some of the medications that you can use for weight loss. And finally, metabolic surgery, which is a special kind of surgery to make the stomach smaller so that the intake of energy is reduced, and it also promotes the increase of a certain hormone called GLP-1, right? And that causes the patient to be diabetes to go back to remission, right? Meaning that the surgery doesn't just help the patient lose weight, the surgery causes the diabetes to go away as well. So these are very powerful treatment methods, and they are not suitable for everybody. So depending on where you are and what kind of medications have been or treatments have been offered, then the different kind of weight management strategies can be employed to help the patients achieve ideal weight targets. Okay. Then of course we need to reduce the cardiovascular risk factor management. So a combination of risk factor screening, reduction in blood pressure, reduction in cholesterol, taking some anti-thrombotic, means blood thinning kind of or platelet reducing kind of medications, and stopping smoking. So these 5 strategies will reduce what you call cardiovascular risk, right? Because you can have diabetes, and if you're well controlled, you have absolutely no problems with the complications that I shared earlier. But if you don't control your cardiovascular risk, you still can end up with a cardiac condition, even if your sugars are well controlled. So you still need to control cardiovascular risk. And then this red section is very specific, looking at cardiorenal protection, which is not just protecting the heart, but protecting the kidneys, right? So when a patient has protein in the urine, that means they start leaking protein into the urine. That's called proteinuria, right? And once you have that, you're on the path of kidney failure. We want to prevent that from happening. And today, there are very, very well-proven drugs that can be used to prevent the progression of kidney disease, right? So these things called SGLT2 inhibitors, as well as the GLP-1A receptor agonist. So these two drugs have been proven to provide not just kidney benefits, but cardiac benefits for the patient if you use them. So a combination of weight management, cardiovascular risk management, and renal medications to protect the kidney will give you the ability to achieve sugar control, right, without increasing the risk that is associated with taking the different kinds of drugs. So to kind of summarize, right, to manage diabetes is quite complicated. It is not just saying that, okay, just have a better diet or take more medications. It's not that simple because it covers a whole range of considerations, everything from weight management to cardiovascular risk to kidney protection, and to prevent patients from taking too many medications that will end up with side effects. Okay, so we really want to not cause side effects by giving too many medications. So what the American Diabetic Association has recognized is that this is very complicated for many patients. How do you manage all these different things without missing out on certain things? So what they've done here is to show you what happens in a 24-hour day for patients with type 2 diabetes, right? So you need to look at this little chart here. Again, this is produced by the ADA, and it tells you essentially 3 phases of looking at your 24 hours for a diabetic patient. So let's start with the daytime period, right? So daytime, we encourage people to have physical activity. We're not talking about like strenuous running, climbing, that kind of physical activity. We are talking about any physical activity, even including walking, climbing stairs. That's good enough, right? For a lot of patients, you need to start slow, aim for things that you can achieve and not overachieve, right? Because if you try too hard, it may not be good for your diabetes as well. So for example, some patients who are on insulin, if they exercise without eating, they will get hypoglycemia or low sugar and they can faint, right? So it is not about suddenly going into physical activity. It's about having it consistently. And ideally, you should do activity that is part of your daily life. So for example, you can climb stairs instead of taking a lift. You can walk instead of taking certain kind of transport between short distances. These are all activities that you can slowly step up. And of course, those of you who are more able to do aerobic exercise should go for at least 2 to 3 days of exercise per week, where your heart rate is more than 150 beats per minute, right? So these are general guidelines, but I think that the key message here is that on a daily basis, a diabetic need to have some form of physical activity, which is very important, right? Because like I mentioned earlier, it reduces what you call insulin resistance. That's the reason why patients have type 2 diabetes. The second phase of the 24-hour period is sleep, right? So you can see here that there are not just how many hours you sleep, but the kind of sleep that you get is important. So they typically define quality sleep as more than 6 hours. Between 6 to 8 hours is considered quality sleep. And anything less than 6 hours, there's an impact on the hemoglobin A1C levels, right? The quality of sleep is important as well. If you have obstructive sleep apnea, that is, if your nose keeps getting blocked and you can't breathe properly when you sleep, then that's not quality sleep, right? That's poor sleep, right? So that will result in worse outcomes for the patient. And of course, the treatment is to treat the OSA. And of course, try not to stay out late. If you're staying out late, of course, you get not only less sleep, but you sleep at the wrong time. And that again has a negative impact on diabetes. So the third phase is really about looking at not sitting down for prolonged periods. So you know that there are many wearables, watches out there that often encourage people to stand up. Actually, one of the easiest way to use energy, right? Because you're not actually doing anything, you're just standing. But standing as opposed to sitting down consumes more energy. And in simply by just standing up, you can actually reduce your risk of diabetes by a huge proportion, right? Because you are passively expending energy that you don't know. So you can see at this chart right here below, right? Any and all of these things, right, will result in reduced glucose, reduced blood pressure, reduced A1C, reduced cholesterol, reduce depression. You can see how any of these activities will reduce your chance of depression and mental health issues, as well as improving quality of life. So this is, again, not random. These are all born out of research that's gone into behaviors in type 2 diabetes. Okay, so how does AI help here, right? So earlier I mentioned that the management of diabetes is very complicated. There are so many components, whether it's activity, sleep, weight loss, exercise, medications, and so on and so forth. So the way AI is used is it is used to reduce the complexity. So AI-powered apps reduce the complexity of type 2 diabetes. Why? Because we can deliver the right type of care to the right type of patient. Not every diabetic patient is the same. We want to use the AI to nudge patients in a way that is customized to them. So for example, patients who are well controlled or low risk or even pre-diabetic, all you need to do is to remind them to stay healthy and not and have healthy behaviors. And you don't need a human to tell you that, right? The machine can tell you that, oh, remember to exercise, remember to watch your diet, that kind of thing. So I think this is very powerful because we know that nagging works, right? Reminding people work. So you must give the right amount of care to the right type of patient. And if you are healthy or you're episodically unwell, meaning once in a while your sugars may be a bit high, this is where the machine can come in and help nudge you towards a better health. And then, of course, for the patients who already have diabetes and who are seeing doctors, taking medications, the machine can help keep the patient on track with their diabetes management and be able to communicate with the doctors if the patient is not doing well in terms of managing their diabetes. So this is living well with the illness, meaning that, okay, the patient already have diabetes for a few years and they are just trying to make sure they don't get worse. Again, AI can play a part by referring the correct patients to the doctors when they are not well controlled. And finally, for the patients who are already having complications like heart problems, stroke, eye problems, kidney problems due to diabetes, this is where the machines can help keep track of the patients and ensure that they stay on track and they don't come to hospitals with complications of diabetes, like I shared earlier. So overall, I would say that the AI is a thing that monitors and help the patient stay on track on the background. And if there are problems, they will be surfaced to the human or the doctors who have who can then attend to the patients who are not doing so well. And of course, doctors have the flexibility to choose how the AI integrate into the existing care model. So one of the key first steps to address the diabetes issue is to go for screening. So I think it's vitally important, right? You don't even know you have diabetes. How do you even begin to treat it? So it's very important to encourage everyone to go for screening. And it's a very simple test, right? It's just simply, go to a doctor or come to one of these screening events that we run at My Doc Lab, and just get a finger prick sugar result. And if you're fasted, even better. If you're not fasted, you can have your blood taken for what you call the HbA1c that I mentioned earlier. So in Malaysia, if your A1C at screening is more than 5.3%, you should go for a formal diabetic screen, because that would highly suggest that you already have some form of early diabetes. And we found that of all the patients screened, right, 10 to 15% of patients will have diabetes or pre-diabetes. So this kind of campaigns and awareness is super important. And because today is World Diabetes Day as well, I think it's very, very important that people are aware that they might have diabetes. If anyone in your family has diabetes, you have a pretty good chance of getting diabetes. So just do a simple finger prick test and you will be able to know whether or not you're all right. Okay, so it's a simple entry point to ensure that a patient may or may not have diabetes. You just simply go for screening. So beyond screening, there are other ways to keep patients on track. So I'm going to introduce the idea of what you call continuous glucose screening. So you can see that there's this machine here, this app here with a little uh, graph here. So this is one of the ways we can monitor your sugar reading. Now, if you think about diabetes, right, what causes it? Well, it's about the kind of food you eat, right? And of course, how much exercise you do. So it's important that we have some way of knowing how the food that we eat affects our sugar levels, right? And that is one of the uses of what we call continuous glucose monitoring devices. Many trials around the world, I've put some references here, have shown that these are what I call real-time continuous glucose monitoring devices. And the results have been positive in reducing what we call the hemoglobin A1C levels, but not the episodes of low sugar, as long as the participants wore the device. So what's this device here, right? So I can show you this picture here. It's a little tiny device the size of about 50-cent coin. Okay, and that what it does is that it's a little wire that goes under your skin, right? Once you've deployed it, so and it will continue to read the sugar values in your body 24 hours a day for 2 weeks, right? So every 3 minutes you will send a result to your phone, and then you can see it drawn out as a chart here. So this particular device is called the Glunovo P3. I put it on myself. And this device, what it does is that it detects the blood sugar in your body and sends every 3 minutes a blood sugar reading to your app that's paired up with the device. Okay, so, and this is 24 hours a day. So after 2 weeks, you're going to get thousands of readings. Okay. Now, the aim of using this device, right, is to tell you what happens to your sugar when you're doing specific activities in a day. Meaning, when you eat certain foods, what happens to your sugar? When you do exercise or you walk or you do certain activity, what happens to your sugar? So this is useful, of course, for diabetics, very, very important. But it's also useful for pre-diabetics or non-diabetics, right? So how is it useful for pre-diabetics? Well, I'm the best example of this. I put this on myself. I'm personally not diabetic. I don't look like this handsome guy here. This is the place where you put the device on your lower part of your tummy, right? It's just a tiny little wire that goes a few millimeters under the skin, and it continuously monitors my sugar. So when I first put it on, I noticed that certain foods send my sugars up very, very high, right? So above 11. So above 11 millimoles per liter, you're considered diabetic. But it doesn't stay high, it comes down very quickly. So I found that this is true for me, right? And quite a lot of my friends who have used this device also found that their sugars tend to peak with certain foods. And for me, the foods are such as certain fruits, like grapes or certain kind of sweet kind of fruits, certain kind of white flour, any kind of white refined flour. So for me, will be things like plain rice, kway teow, bee hoon. All these items cause my sugars to spike, right? And it has a permanent effect on me because I've stopped taking those kinds of food or reduced the amounts of those kinds of food because I know that it will cause my sugar to spike. Okay, so this is quite useful because now I'm very aware of the kind of foods that I eat, and I tend to avoid certain foods so that my sugars don't spike. And of course, this is not forever, right? Meaning that you don't wear this device forever. You wear it for only 2 weeks, and after 2 weeks, you will have known what kind of foods you can and cannot eat, and therefore you can now adjust accordingly based on the kind of food intake and therefore the kind of sugar results you will achieve. So the aim of this device is not to be used indefinitely. It's just you're supposed to use it for 2 weeks, adjust your diet habit, and then continue. And you can of course do it again just to confirm that what you have learned the last time is indeed true about your sugars. So for the non-diabetics or the diabetics, it's also useful to see what happens when you exercise. So for me, when I start exercising, my sugars go down. Okay, and that's quite a normal response for humans when you start exercising because your body is trying to move the sugars. So temporarily it will go down, but after you've mobilized the sugars, your sugars should be normal. And for those of you who are more athletic, who do running or cycling or swimming, this is also a great device to tell you, after you've done running for say half an hour or so and so forth, what's your sugar level. And some of you may use it for fueling, meaning when to take certain energy type bars when you are running, for example. So well, one important thing is that this device is waterproof and you can exercise with it, you can go swimming with it. And importantly, it's not socially intrusive, right? Meaning that, it's not a machine that you have to carry around. It's just your phone, right? And there's this little device that you can put on your tummy area. But I must warn you that after you put it on, right, you become very obsessive, right? I was checking the device all the time, before I eat, when I'm eating, after I'm eating. I was just so obsessed with it. I was counting, how long before my sugars peak and so on and so forth. But of course, not everybody would be using it that way. Most of us would be using it to tell whether or not certain foods cause sugars to go up. So this is a screenshot of the device, of my trace when I used it. So you can see some peaks, and then there are some red dots here that are hypoglycemic episodes. I think they're not really hypoglycemic episodes. They're probably just errors from recording. But you can see that I have a couple of peaks here because I was eating certain foods. So this is how I used it to tell me what happens to my sugars throughout a 24-hour period. It is also very rich in terms of giving you data about how often are you within the range. So you can see this is the average, this is the sugar readings and the moving average. So for those of you who are interested in how often are you within target, you can see that I'm 97% within target here. And occasionally I have highs due to those spikes. And again, you can analyze the data and see, okay, wow, how many times I've been low, how many times I've been high. And I can look at those timings and look at that point of time what I was doing while I was eating to tell me whether I should modify my behavior. So overall, I would say that having this continuous glucose monitor is extremely useful to help modify your lifestyle. Of course, medications are extremely useful as well. You must not forget that those of you who are on medications should continue to take your medications. And to use the continuous glucose monitor as an adjunct, meaning something to help you manage your sugars and manage your diet. So in MyDocLab, we have an app. The version 2 app will be able to show your sugar readings throughout the day, much like what I showed you, except that the MyDocLab app is integrated with everything else about you, right? So it's a one-stop health management application, especially for diabetics, right? And we built this because we felt that patients shouldn't be going to many different places to get information or to get help about managing their conditions, and they deserve to be healthy, right? So, the MyDocLab version 2 app is a one-stop e-commerce application as well. So you can buy certain things like BP machines or sugar continuous glucose machines, and you can get them shipped to your place. You can, of course, also arrange for consultation either online or in person with your doctors around your area. So we provide this kind of interface and specific doctors whom you want to see. And you can message them, you can organize a teleconsult, you can schedule an appointment to see the doctor as well. And like I mentioned earlier, instead of just giving you data on an app and then your data is everywhere, the MyDocLab 2 application allows you to integrate all your health data in one app. So everything about your diabetes, or if you have other conditions like thyroid issues, you can get all the blood test results in one place, right? And of course, most of us go to different doctors for different reasons. And you can have different blood tests done at different places. So you can upload your blood test, for example. So you can take a picture of it, or if you have a PDF or some kind of file, you can upload it and we will keep it securely for you, right? And when you visit a doctor or a clinic and they want to look at all your past records, everything is here in one place. You can see not just your blood test results, including other tests that were done in other clinics or hospitals. So with all this information, what we can do for management of diabetes is that we know that, certain patients are diabetic, and are they doing well? Have they been getting the right medications? What's their sugar value? What's their result? And based on these sugar value and results, we would then be able to use the AI to suggest to the patient, like this patient here, Sarah, whether or not they should go on a specific kind of regime, or they should see a doctor, or they should purchase a continuous glucometer to help them manage their condition, right, on the e-commerce side. And finally, if they do well and they are indeed well controlled, then we will reward and say that, hey, you're doing very well. I will remind you that in 3 months' time, you should pick up these medications and so on and so forth. So all this automation is possible when you have all the data in one place in the MyDocLab 2 app. So when we know about the patient's condition, we don't just think about, oh, is she diabetic or is she well controlled? We think about the 360-degree profile of the patient, everything from what medications you have bought, what kind of machines you have bought, to what are the interactions you have had with your doctors, and we can then suggest certain things that this patient should go for. Okay, so finally, I just want to say that what happens behind all of this is not just human-centered, right? This is very much AI-driven, meaning that we are able to take patients' risk factors and their medical conditions and the medications they are taking, and calculate what you call a segmentation score, or like a risk score, right? Then you couple that together with how the patient responds to this kind of risk scores, and you can give what you call a nudging score. A nudging score would tell the patient, okay, how many times should I remind you to send in your sugar reading? Or how many times should I remind you to send your blood pressure reading? So this kind of nudging scores will help us tailor the advice that we give to our patients, rather than just saying that everyone's the same, everyone should have the same kind of alert. And after a while, patients get a bit bored of the kind of responses, right? Whereas using the AI, we are able to adapt and customize the response to the patient depending on their condition. So with that, I think I'll come to an end of my discussion. This is more for the doctors who are perhaps on the call. We also have a portal for doctors to manage their patient's condition, and it's also driven by AI. And we hope that a combination of having the information at your fingertips together with your doctors knowing about your condition will lead to a better outcome in terms of diabetes management. And with that, I come to the end of my talk. To conclude, I think that everyone should know that diabetes is on the increase and we should screen for it. Please go to your doctor or in our clinics, or go for screening and screening campaigns to check for your sugars. Diabetes is very complicated and it's hard to keep track. So some devices such as continuous glucose monitors may be useful in managing diabetes. And finally, using AI can help patients get better control of diabetes without excessive visits or excessive complexity when it comes to managing of the diabetic condition. Okay, thank you for your attention, and I'm open for questions at this point.
Thank you, Dr. Ngiam, for the insightful and fruitful talk. And we have learned so much from your talk, and I think they are absolutely beneficial to us in improving our life quality. So yeah, now we have come to the Q&A session. Before we jump to the questions, I would just like to remind everyone to check out the link in the chat box that I just put up. All right, check out the link, click the link to fill up your attendance. And once you have filled it up, after the webinar, you will be getting an e-certificate later on from our end. So yeah, so now come to the first questions, right? This is a question. Let me read out the question, the first one. I heard about inositol supplement that could lower blood sugar naturally. Can Professor confirm this and elaborate about it?
Okay, thanks, Wong. So the question is about taking medication. Is it a temporary solution to bring it to a manageable level, or is it permanently something that you have to take permanently? So to answer that question, the medications is to help you control your sugars. If you can control your sugars using a combination of diet and lifestyle and weight loss, then you may not need to take medications at all, right? So it is not intended to be permanent, but many patients have trouble trying to manage their diabetes because they can't change their lifestyle, or they can't lose weight, or they can't engage in some form of exercise, and therefore they have to be on medications. And indeed, many of the diabetic patients are permanently on medications. And the reason for that is a combination of what I said earlier. They can't manage all these lifestyle changes due to a variety of reasons. And also the fact that their disease may have progressed beyond a certain stage where they need to be on medications permanently. So just to summarize, right, the taking medications to control diabetes is not intended to be permanent, but for many patients it is, because they can't change their risk factors or their disease has progressed beyond a certain stage. So ideally, you should be able to manage your lifestyle conditions rather than to wait until your disease is so bad that you have to be on medications permanently.
Thank you, Dr. Ngiam, for the answers and advice. The next question that I've got is that, is taking medication a temporary solution to help bring to a manageable level or permanent taken?
Well, I think I answered that question, Wen Kwa. Your other question that you asked was whether about supplements and whether it helps with diabetes, right? So can I confirm that?
Yes.
Okay, so maybe I'll answer this second question, which is about supplements. Can certain supplements help manage diabetes? So earlier I showed a chart by the American Diabetes Association, which shows you the set of medications that are proven to be effective in managing diabetes. Now, I know that there's a lot of news articles or websites out there that promote one kind of drug, one kind of supplement, some kind of plant herbal extract. I don't know that those things work. I really don't, because I don't know what's inside those drugs. But let me share something with you, right? A lot of these so-called supplements and herbal things, they contain the same ingredients as the ones that I showed you earlier. And many marketing people or salespeople say that, oh, well, instead of taking these Western medication, very strong, can cause kidney injury, why don't you take this healthy, natural supplement? Well, let me just warn everyone of two things, right? First thing is that you don't really know what you're paying for in these so-called healthy supplements that help prevent diabetes. And the other thing is that we don't really know how effective it is. And when it comes to managing sugars, right, you need to be quite precise. Right? You can't just say that, oh, roughly we just take one of these or two of these and see what happens. I think it's best to stick to your doctor's advice and to stick to medications that have been proven to work by millions and millions of patients, right? And we're not talking about these medications, especially metformin, right, being like super expensive medications. They're really quite cheap, right? And they are very, very effective. And of course, the second line medications can be expensive because they are quite new. But for patients who need it, i.e. the patients who have poorly controlled diabetes, I think it's a lifesaver, because you can take all these supplements and spend a lot of money and still have no impact on your kidney or your heart disease progression. So in summary, I think that one should stick to proven treatments and take advice from your doctor to control your diabetes.
Thanks, Dr. Ngiam, for the answers. And the next question I have received is, Doctor, I heard that metformin is not good for the kidneys. What is your opinion on this?
All right, thanks for that question. So this is a common misconception, okay? Ironically, metformin is actually good for the kidneys. In fact, it's renal protective in many ways, right? But the problem with this myth is because people have read somewhere that, oh, if you take metformin, and you go for a scan, you can get kidney injury. Now that's true, right? If you go for what you call a contrasted scan, right, meaning a CT scan or some kind of scan that uses a kind of dye or what you call iodinated contrast. Yes, metformin can interact with the dye. The scan itself doesn't cause any problem, right? But the dye together with metformin can cause certain problems to the kidney. The term we use is lactic acidosis. So simply put, metformin does not damage the kidney. It is only in a very, very specific circumstance when you're taking metformin and you're going for a CT scan with contrast with the dye, that it can affect the kidney. So typically before you do a CT scan or any kind of scan that uses a dye, the doctors or the radiographers will ask you whether you're taking metformin. And if you are taking metformin, it's not a disaster, right? You can either stop it a few days before, like 3 days before, or during the, if you have to use the contrast, then you can give certain kinds of treatments to reduce the impact of the contrast on the kidneys, right? So it's not the metformin causes damage to the kidneys. It's only can possibly cause it when it's used in combination with certain kinds of contrast.
Thank you, Dr. Yam. Right, so the next question that I have got is I noticed that Glunovo P3 is rather expensive. Where can I get it? All right, I think I can answer this question.
Yeah.
For those who are interested in about Glunovo P3, please contact Medivent. You can visit our website and send an email to Medivent's officials. Then we will attend to you.
Okay.
And then, yeah. Anything you want to say?
Yeah, I just want to add, right, about expense. Let me explain something. So there are many kinds of continuous glucometers in the market. So you will find some that are slightly cheaper. But let me just say something different, right? Glunovo has different models of continuous glucose monitors. Broadly speaking, there are two kinds of continuous glucose monitors. One is what you call a real time, which is what is Glunovo P3, right? Which is every 3 minutes, you will send a reading to your mobile phone. And then there's scanning type machines where you need to scan your phone or the device to the sensor to get the reading. So both will produce the same kind of data. It's just that the second one, which is you need to intermittently scan it, it doesn't give you real-time readings. So depending on your use case and what you prefer, you can pick the cheaper one as well. But my sense is that for a little bit more, you can get continuous readings, right? That is far more effective and less troublesome for the user. So again, it comes down to personal preference and what the doctor suggests to you. I would say that if it's just a little bit more, it might be easier to just get the continuous real-time CGM rather than to have a scanning type CGM, because that's a bit troublesome and you may not get all the readings that you want.
Right. Thank you for the answers, Dr. Ngiam. Right. And next questions is Doctor, what is your view on oxidative stress on pathogenesis of type 2 diabetes?
Okay, so before I can answer that question, right, I need to explain what oxidative stress is. So to interpret the question by Jaffer, right, oxidative stress is a kind of cellular or cell level kind of process that results in damage to the cell. Okay, so think of it as you're exposed to certain things that cause damage to the cell. So common environmental things are like UV light, some sunshine, smoke, like smoking and all the chemicals in the smoke, they can cause oxidative stress, which is damage to the cells. So the question therefore is, can all these damage to the cell result in type 2 diabetes? And the short answer here is generally speaking, no. But a combination of certain things that I shared earlier can of course lead to type 2 diabetes, right? So one can argue that high sugar, constantly being exposed to high sugar, is a kind of oxidative stress or pro-inflammatory state that results in the development of type 2 diabetes. And Gaffer has correctly pointed out that some oxidative stress, specifically to the pancreatic cells that produce insulin, can result in the development of diabetes. So, but it's very hard to say that every kind of oxidative stress will cause diabetes, right? It is oxidative stress specific to say the pancreatic islet cells that produce insulin that may contribute to the development of diabetes. Okay, so yes, it does, but it is not the only cause of developing diabetes.
Right. Thank you for the answers, Dr. Ngiam. Next question is what is the cost of AI solution? So I think I can take this. So it is free of charge for the users.
Yeah, so that's the whole idea about the AI solution, right?
Yeah.
It is incredibly effective, right? If you can correctly tell a patient what to do when they have diabetes, and of course, it's given to our patients who download the MyDocLab app and use it for free, then why not, right? Because it really reduces your risk without expense at all. Advice should be free. Medications, of course, and devices like Lenovo cost money, but a combination of these would nudge patients towards better outcomes for diabetes.
Thank you. Next question is what is your preference in terms of class of medications, DPP-4 inhibitors or GLP-1 agonist?
Okay, so thanks for that question, Gaffer. So it's not a preference issue. This has got to do with indication. So you saw earlier in the ADA or AACE chart that I shared with regards to how doctors prescribe first line and second line anti-diabetic drugs. So first line, everyone gets metformin, right? There's no question about it. So then the matter of whether you add a DPP-4 or GLP-1 agonist depends on a number of factors. So a key factor is whether the patient has heart failure or kidney injury. So the data for GLP-1 receptor agonist is superior in terms of treating patients with kidney injury and diabetes. So whereas the DPP-4 are pretty, again, there's pretty good evidence for patients who are especially obese diabetics, right? So it really comes down to what other complications and what other organic profiles that the patient has rather than my own preference. Personally, I won't say that, oh, I like one over the other. It simply comes down to the patient profile and what are you trying to prevent the patients from getting. Yeah.
Thanks for the answer. The next questions that I've got is do you encourage keto, intermittent 168 fasting?
Okay, again, thanks for that question from Yvonne. I need to explain what keto and intermittent 168 fasting is. So keto diet means that you completely avoid carbohydrates and you just take only protein and fat, right? So that's what we call keto diet, meaning keto is the short form for ketotic. Ketotic means that you force your body to use up the fats and the proteins in your body so that you can what you call burn fat and reduce your risk of getting diabetic. So there's a lot of studies that are done on keto, but let me just point out two very important facts, right? First thing is that keto diet is not shown conclusively, right, to prevent patients from getting diabetes. Okay, so although your risk of developing diabetes with keto is less than a person who's just taking a high carbohydrate diet, but for some reason, keto diets increase your risk of cardiac related conditions. And the mechanism is not very well studied, but simply comes down to the fact that if you don't take enough carbohydrates, right, you need to take more fat. And when you take more fat, right, you're going to expose your heart and your other organs to higher risk of coronary artery disease. And because of that, the risk of cardiac conditions also increase consequently. So in trying to go into a particular diet, you end up increasing your risk on other conditions like heart conditions. So overall, I won't advocate for keto diets, but certainly I will advocate for a balanced diet. So use the the healthy plate kind of distribution of food, right? And you'll be sure that you can reduce your risk of everything without increasing your risk of getting a heart problem. And the same is true for intermittent fasting, right? So intermittent fasting is extremely useful for patients, especially patients who are overweight and patients who are early diabetics, right? Because you essentially cut down the amount of calories you take on a per day basis, or you either restrict it to a certain number of calories. Now, whilst it's very good at weight loss and very good at reducing your glycemic control, again, there is some risk involved, right? Which is, don't forget, the moment you stop taking intermittent fasting, you're going to put everything back on again. And one of the problems with both keto and intermittent fasting is that it triggers your body to want to store fat. So that overall may not be a good thing over a long period of time. And of course, for those of you who are taking these two kinds of diets in a short period, in short term, meaning 1 to 2 or 3 months, right, you will see the effect very quickly. But remember, what happens after that 3 months? You're going to be eating intermittent fasting for the rest of your life. So that's the questions one has to ask yourself. So overall, I would say I won't encourage either. I would say you should go for a balanced diet so that you have a happier lifestyle. You can eat certain things without forcing yourself to be limited to keto or to be fasted the whole day. Yeah.
Right. Thanks for the questions. So the next question that I received is thanks for the answer. Sorry. The next question I received is I show my doctor my CGM results. He just flipped through and not really interested. He just want my HbA1c results on that day to decide. So do you have any advice on this? Dr.
Yeah.
Ngiam?
Okay.
Yeah.
So some doctors today in Malaysia don't use the CGM because they're either not familiar with it or they don't know how to give you the right advice with it. And equally, I would say that patients who buy CGM machines should be aware of how to use it, right? So how you should use the continuous glucose monitor is to ensure that when you do certain activities, like when you eat certain food or you go for exercise or you walk or you do certain activities, you clock it into the device, meaning that the app usually comes with a button that allows you to put in how much food you eat or how much exercise you've done and so on and so forth. So this is important because with that kind of data, the doctors can then interpret that result. Because you can imagine, right? This is data for 2 whole weeks, 24 hours a day, and you pair it together with the activity or the diet that you're taking. With that, you can make some adjustments to your diet, to your activity to reduce your chance of progressing for diabetes. Whereas if you just do a hemoglobin A1C, right, it tells you how your control has been on average over the last 3 months. So it's very coarse, right? So let's say I say your A1C is a little bit high, 7.2. So what does it mean? What do I change? Do I ask you to reduce white rice, or do I ask you to take more of certain thing or less of certain thing? I can't tell you anything because it just tells me that your control has been not so good. So what does that mean in real terms? So this is where data from the CGM comes in, right? The data from the CGM would then the doctors can then use that information to help you adjust and fine-tune your diet and your activity levels so that you can get optimal or flat sugar control over the period of time that you're wearing it.
Okay. Thanks for the advice, Dr. Ngiam.
Mm.
Right. The next question is can thyroid affect my sugar level, or rather sugar level affects my thyroid? Does it mean if your sugar is at good level, your thyroid level will be good too?
Okay, thanks for the question. So the sugar control and thyroid function levels have nothing to do with each other, right? So thyroid does not cause diabetes, nor diabetes cause thyroid functions to be abnormal. So they shouldn't be associated with each other. The only time that this can be a problem is that some of the symptoms of high thyroid look like symptoms of low sugar, right? Because if you don't know what's your thyroid values and you have low sugar, the symptoms can be quite the same, right? Where you feel anxious, you feel heart beating very fast, you are sweating, you're feeling hot. They look like that in terms of symptoms, but they are completely different things altogether. So I don't think they should be related to each other. Okay. Are there any further questions, Wong Kwang?
Sorry, I was muted just now. Thanks for the answers just now. So there's another questions that I received. It is in Malay, but I'll translate to English. Prof, is it true that SC insulin is better from the tablet for metformin? And is there any effects like hair loss or weight loss by using metformin?
Okay, thanks for that question. So first thing, need to explain what these things are. SC means subcutaneous insulin. That means it's an injection under the skin with insulin, and of course, metformin is a tablet. So they're completely different medications, right? It's not that one is better than the other. They are used for different purposes. So like I mentioned earlier, anyone or everyone who is diabetic, unless they are allergic to it, everyone should take metformin. Okay, there's no diabetic patient who should say that, oh, I don't feel like I want to take metformin, because metformin is very effective, it's very cheap, right? And it is great for patients to maintain the baseline sugar levels. Okay, so I think every diabetic patient, if they are proven to be diabetic, should be on metformin to control their sugars. Now, insulin is the ultimate form of diabetic medication because it directly works on the cells, right? Meaning that if you inject insulin, you will push the sugars into the cell. Whether or not you have cells in your body, like in your pancreas that produce insulin, you're now injecting it into your body. So it's going to be very, very effective. And typically, insulin is used for patients who have tried many different medications and their sugar is still very, very high. Then the doctors have to give insulin to these patients. So this is for the type 2 diabetics who have been having diabetes for quite a while and are poorly controlled. For the type 1 diabetics, like I mentioned earlier, 100% they have to be on insulin. They cannot produce insulin at all. So they cannot take metformin, right? So type 1 diabetics should be on insulin because they cannot produce insulin. So we are talking about two different drugs and they're used in a different way. It's not that one is better than the other. Like I said, all type 2 diabetics with proven high sugars should be given metformin. And if they are really poorly controlled, they can be given insulin on top of metformin.
Thanks for the advice. The next question that I received is, in the next 5 years, do you see AI a partner in the management of diabetes or a threat to medical professionals when the machines are able to learn deeply and efficiently?
Okay, so thanks for that question, Jeff. I don't think at any point of time you can replace a doctor with a machine completely for diabetes management. I think it's only true for certain patients where they are fairly well controlled and they just need some lifestyle advice, right? But for management of intermittent or long-term diabetes, you still definitely need a doctor, because a lot of the diabetic medications, the way that it's being used needs to be managed very carefully, at least in the next 5, maybe 10 years. And at some point of time, we will have some form of AI that is good enough to be able to deal with all the different complex combinations of what diabetic patients have. But until that day comes, right, you still need doctors to manage that properly. And the other thing to mention here is that none of the AI tools today, none of them, not a single one, right, out there will tell you, oh, you have diabetes, you take this medication or increase the dose or start a new medication. So none of the machines do that today. They only suggest that you see a doctor. They suggest that you have lifestyle activity changes, or they nudge you to do certain behaviors. None of them will say, oh, tomorrow take extra half tablet. No AI machine will do that today, because it's not proven and certainly not sufficiently mature to do that at this point.
All right. Thank you for the answers. All right, we have a few more questions. The next question is, hi, doctor, for a newly diagnosed diabetes patient, would you be able to advise whether we should prescribe CGM to the patient after the diabetic condition is stabilized, or can start concomitantly with metformin? Any specific time to start CGM for a newly diagnosed patient?
Okay, thanks for that question. I believe this question comes from a doctor. So yeah, so the answer to that is you should, additionally, we have been prescribing medications to treat the diabetes at the onset. So That's true. And ideally, you should wait for the sugars to stabilize before you start a CGM. But don't forget, right? The CGMs are not there for you to prescribe medications. They're mainly there for the patient to get the correct lifestyle and diet advice based on the sugar, or get the correct lifestyle and diet plan based on the sugar profiles that they have. So increasingly, physicians and endocrinologists are using it even as a newly diagnosed diabetic patient, because it allows the doctor to know what is the patient's habitual eating and activity cycle over a 2-week period. So even as the sugars are being controlled with metformin, that's okay. You will give the doctor a picture of what the patient's lifestyle profile is relative to the sugar. And at the end of 2 weeks, right, they can either adjust the medications and give specific lifestyle advice to the patient, or a combination of both. So the short answer is yes, increasingly it's being used for management of newly diagnosed diabetic patients as well.
Okay, thanks for the answers. Right, so we have several more questions asking about which link you can click to purchase for CGMs, right? So the short and which contact number you can reach out to get your CGM. So the answer is you can always go to Play Store, Google Play Store, Apple App Store to download our MyDocLab app, mobile app. We will put up which clinics or pharmacies in which the CGMs are available. Yeah, just search MyDocLab in the Play Store, and then you will see our app. Yeah.
Yep, that's great. So yeah, these things should be available, and please go ahead and use them if you find the correct indication. So I'm just going to answer the last 2 questions that are on the Q&A board. So from Jin, the question is HbA1c of 7 acceptable for those age 70 and above? The short answer is yes. Okay, because the ADA even recommends that we can customize A1C targets depending on the patient's age and their comorbids, right? So for patients who are older and they have more other conditions like heart problems or stroke and so on and so forth, we don't want the control to be too tight, because there's also the opposite risk of causing low sugars or hypoglycemia. So A1C of 7 is very acceptable for those age 70 and above, especially those with multiple health conditions. And the last question is about chronic diabetic patients. What is the most suitable exercise for them? Well, it just comes down to what level of exercise the patient is able to undertake. So of course, the more cardio type and strengthening type exercises, the better, because it exercises the heart as well as the muscles, which I mentioned earlier right in the beginning of my talk, that it reduces insulin resistance. So the more strenuous that activity a person can undertake, the better it is for their diabetes. Of course, subject to their physical fitness levels, right? You don't expect, say, a 80-year-old diabetic who's never ran in their life, right, suddenly to get up and start running, right? So it's not going to work for patients like that. So you need to tailor the activity according to their ability to undertake them. And of course, like I said, the more cardio and the more strengthening exercises they are, the better it is for the patient.
All right, thank you, Dr. Ngan. So one last thing that I would like to inform everyone is that please visit our website at mydoclab.com, www.mydoclab.com, and you will stay tuned for more updates and more information from our organizations. So and on top of that, right, I would like to also inform everyone that apologies for some communications informations that I would like to inform that currently the app is still publishing, so we are going to publish in the next few days to 1 week. All right, so until then, we stick to our website first for more information, and stay tuned, and you'll get more features from our app, including the CGMs and everything that from our list of clinics and pharmacies in our app. All right, so I think we have answered all the questions. So we have come to the end of the webinar, and thank you very much, Dr. Ngiam, for your talk. And I think we have learned a lot from you. It is so insightful and fruitful, and I believe it's not just me, but everyone here has learned so much from you. So we are grateful for your time and valuable contributions for today's discussions. So and also I would like to extend my gratitude to all the attendees for your active participations and engagement in this webinar. Your questions and feedbacks are valuable to us. So thank you once again. So here I wish you a good evening ahead, and please stay safe, live healthy, live happy. Thank you and goodbye.
Experience seamless healthcare management with our all-in-one integrated platform.